I'm Dr. Doggett at Striegel Animal Hospital, and we know that you sometimes have questions about your dog's dental procedure. So we've written down the most frequent questions that we get, and my assistant Carla is going to ask those to me for you.
Dr. Doggett, how do I know, sorry, Dr. Doggett, how do I know my dog needs a dental exam?
Well, sometimes it can be just as simple as they have really stinky breath. Another thing you can see is when you have plaque and tartar building up on the teeth. That's definitely a sign that they need a dental exam. Actually, if you have a small breed dog, even if we don't see a lot of buildup, it is recommended that they have their first under anesthesia dental cleaning by the time they're 2.5 years old, because we have so many genetic dental disease problems in small breed dogs. We want to stop the disease progress and keep their teeth healthy for as many years as we possibly can.
How often does my dog need a dental exam?
Well, this is really individual. Some dogs will only need it every few years. I have seen some dogs, larger breed dogs, that are 10 or 11 years old before they actually have any amount of plaque and tartar buildup. And unfortunately, it's a genetic luck of the draw. And our smaller breed dogs, again, should have their first under anesthesia cleaning by the time they're 2.5. Sometimes they need them as frequently as every 6 months if they have really, really bad genetic dental health. And this is all to keep their teeth as healthy as we can for as long as they can and prevent multiple tooth extractions on a yearly basis.
How do I know if my dog's teeth are causing them pain?
So one of the things you may see is that they're chewing their food only on one side, they're chewing their toy only on one side. A lot of times they don't chew their food at all, so this may be something that is not easily seen, but if you see that they are kind of delicate when they're getting their food, or they're tilting their head to one side when they get their food, or they're chewing on their favorite toy only on one side, these may be some signs, or a reluctance to eat. This is definitely a major sign of pain. There's not a lot that'll keep a dog from eating because they really like it. Hesitancy for you to reach up and pet their head because their mouth hurts, that would be another sign.
Is there anything I can do to help my dog prepare for a dental appointment?
So one of the things that we love to offer are pre-operative visits so that we can make sure the health of your dog is as good as possible. We offer ECG screening with a cardiologist interpretation. It's a very low cost test that can tell us how healthy your dog's heart is and if they are okay for anesthesia. Another thing that we offer is complete blood work, liver and kidney function, electrolyte balance, red blood cells and white blood cells. So are we making enough red blood cells to carry oxygen appropriately, or do we have an infection already that we need to address? So these are some things that we offer before the anesthesia so that we can tailor their anesthesia just to them and make the safest possible decisions for their anesthetic protocols.
Will my dog be getting dental x-rays?
Yes, every single dog gets dental x-rays every single time. So the tooth that we see in their mouth is only half to a third of their tooth. The rest of it is under the gum line. And we can have teeth that look absolutely fantastic just visually in the mouth, but are really diseased. So on x-ray, we may see that part of that tooth isn't even there, which means under the enamel we have a lot of tooth loss. Or we can see an abscess at the root of the tooth. We can see that it died many years ago and it's not discolored, but we have issues there due to this tooth being dead for multiple years. We can see fractures that we may not see just on a visual inspection. There's a lot of things that we can see.
How long does a dog dental cleaning appointment take?
So a dog dental cleaning varies in length. Anything from just under an hour for a dog with good dental health and just some plaque and tartar that we need to clean up, to a dog that needs multiple extractions and has maybe lost a lot of bone in the jaw due to disease. So in those cases, we take longer because we don't want fractures of the jaw. We want to make sure that everything is as safe as possible. Every extraction we do is a surgical extraction, meaning that if bone needs to be removed, we remove that, we make a flap, we sew the gums shut. If there are multiple roots on that tooth, we section the tooth so each section comes out with only one root. This helps ensure that each extraction is done as safely as possible and with the least amount of pain.
If my dog needs extractions, will he be given pain medication?
100%. So part of what we do is we do an anti-inflammatory injection, unless your pet is already on anti-inflammatories or it's contraindicated in their health. We also do nerve blocks for the extractions, just like our dentist does. And fortunately, because they're already asleep, those injections don't hurt like it can with us. So their mouth is going to be numb, and that provides long-term, so that area of their mouth will be numb, and that will provide hours of pain relief after the extraction itself. And then we also send home medications to help with their pain control.
This is the call to action. If you have any questions regarding typical dog dentistry appointment, please give us a call. We'd be happy to walk you through it.
Thank you so much for all of your questions. They were wonderful. If you have any further questions or questions we haven't addressed, please don't hesitate to reach out to us. We would love to answer any questions you have specifically regarding to your dog or the procedures themselves. Hope to see you soon.